To our CNPS Consensus Technology colloquium. We're very pleased and privileged to have Dr. Talino Bruno, who is a graduate well promoted with that. I would like to ask Catherine to do a short introduction about Dr. Bruno's background. I'd like to send you a welcome, and we have food, lots of room here, and we have handouts, etc. So, Catherine.
Hi. So welcome. This is another colloquium part of our community connection series, and I just wanted to welcome you and thank you for coming to attend this informative talk. Dr. Bruno is a graduate of our Human Development and Learning and Culture program, and he did his Ph.D. work on cognitive distortion with adolescents. So so that can connect, as you can see, to the topic of today. So he works with the Fraser Health Authority as a youth addictions counselor. He brings a wealth of experience and education to be able to support us in our learning process as we bridge over into the real world. So welcome, and if you have time at the end, we would appreciate, and this is optional, if you could sign our sign-in sheet, which is right here. It's an attendance list, and it's just supporting our UBC alumni process. Should I pass around? Okay, pass around then. So thank you, and
thanks. Thanks for coming. Last time I did a presentation here was my doctoral defense, so I started crying. I don't know why.
Feeling nervous?
just a little bit. But the other thing I was going to say is I'm not limited to an hour. I'm in no rush to go back to work. So if we go extra, I'm cool with that if you guys want to ask questions. Because I find that a lot of these presentations, it's the questions where you tend to learn a lot more. Because I may touch on something but not touch on enough, or you may be interested in something I haven't touched on. Having said that, when I was asked to do this, I'm always kind of wary about what do I talk about, especially to a university crowd and a graduate level crowd, about what level. But from my experience, no matter the amount of education, there's a lot of misinformation about drugs. Okay, unless you work in the field, there's a lot of things that we have these preconceived notions, ideas that there's only one form of treatment. So what I'm going to do today is talk a little bit about. We'll get to that in the last one. We'll talk a little bit, really basically, about different areas of drugs, the type of drugs, their long-term effects, and touch a little bit on how we look at the model that we look for therapy. We're not going to be touching too much on therapy because each one of these standalone sections is an hour presentation in and of itself. So I'll be touching on them. When we, for those of you that are old enough, you may remember this during Reagan's years, the egg and the, okay. We're not talking politics this time. That's a 3-hour conversation about drugs. So, brief overview. We're going to look at some of the problematic use. What is problematic use? And I use problematic use because there's so many different words that people use. There's addiction, there's dependence, and I'll clarify the difference between the two. Some of the risk factors, the continuum of substance use. Where do people lie in a continuum? Because there's people that don't use it all, and then there's addicts and in between. And where is that kind of that slippery slope? I would argue that the slippery slope can occur at any time. Okay. Drugs and their effects, that's the kind of the bulk, but I don't want to, I'll have pictures of drugs and I'll tell you a little bit of the slang terms and things like that, but I don't want to kind of just go over every symptom. I'll just kind of tell you more or less the basic repercussions of the drug use. And it's also in your handouts if you want a more concise list. And then dealing with addiction. What do you do when somebody's addicted? What is the continuum of care in the Fraser Health Authority bridge where I work, and in the Coastal Health Authority too. So, if you have any questions, feel free to ask. If I know I'm going to answer it later, I'll let you know. If not, I'll do it. So, like I said, you're more than welcome to stay because there's about 190 slides. I'm exaggerating, but a lot of slides, and I don't want to rush through it. But also, I'm aware of your time. So, like I said, I'm more than willing to stay as long as you want afterwards. I don't have any kind of time limit. Okay? Any questions so far? Good. So, what's a drug? Seems like a simple question, doesn't it? What's a drug? Yeah, very good, yes. Anything else?
Sorry, I couldn't hear what you said.
Oh, something that modifies your natural state of being. Very eloquent definition.
Well, I think it's a chemical.
Can be, yeah.
Oh, maybe not. Well, I mean,
So, basically, any substance other than food which changes the way the body or mind functions. Okay? So, now some people will argue, what I was saying there is, some people will argue that shopping is a drug, which is not a chemical. Or gambling.
love is a drug.
Love is a drug, and Foxy Music will say. Yeah, exactly. So, and those are more kind of like, well, that's more kind of the colloquial use of drug. That's more of an addiction. Okay? Now, it may or may not have medicinal properties or purposes. Heroin has medicinal purposes, but is also used illegally. It can come either from a plant, or a lab, or a little bit of A, a little bit of B. Once again, let's look at our friend heroin. It comes from morphine. People assume that heroin comes from poppy. It's not heroin that comes from poppy. It's morphine that comes from poppy. Morphine then is distilled or synthesized into heroin. Okay. And as an aside, by the way, I'm going to be throwing a little drug trivia here for you anyways. The first people to market heroin were, it's a very famous drug company. Bayer. Yeah, Bayer. Because it's a narcotic analgesic, but they thought it was less addictive than morphine. Wrong. So, it could be legal, illegal, helpful, or harmful. The legal, illegal is more cultural and societal. Okay? Helpful or harmful is a matter of subjective opinion. And we'll touch a little bit more on that. So, substance use, appropriate use, and I use appropriate use quote unquote, because appropriate use depends on your context and who you're dealing with. If you're hanging out with the kids in an alley and smoking weed, that's appropriate use of weed. If you're the parents of these kids, that's inappropriate. Okay, so you've got to look at the context. Okay? So, appropriate use, typically to treat illness. That's what we, when we think of drugs, and some people say drugs, well, typically to think illegally, but when you think of pharmaceuticals and prescription drugs, you think of treating illness. To reduce pain, to prevent illness, inoculation. Manage mental illness, antidepressants, anti-anxiety, antipsychotics. Helping body do things that it can't do on its own. Most common example would be insulin. And appropriate use, as I was mentioned, is influenced by factors such as religion and culture. Okay? Some religions and some cultures frown upon any drinking, whereas other cultures, that's part of growing up. I grew up in an Italian household, and one of my earliest memories was when my dad used to make wine the old school way with the press. He'd give me a little cup, and I'd put the little cup underneath the grape juice coming down, and it was fizzy because it was fermenting. I liked it. Didn't become an alcoholic, mind you, but I liked it. That was normal. That was a normal cultural event. And if you look at the levels of alcoholism between countries, let's say Southern Europe, Portugal, Spain, Greece, Italy, and countries that are more, more prescriptive about alcohol use, such as England, Germany, the alcohol rates are far higher in Northern Europe than they are in Southern Europe. So there's that cultural point. Now, there's substance abuse and misuse. Never been a fan of the word misuse, but it does, in certain situations, it does kind of describe what is going on. So, the way I kind of look at it, and I'll touch on this, is that any use of drug that causes problems in either your health, work, relationships, legal, financial, or emotional problems, and some say even spiritual, is being misused. It's problematic use. Okay? That's not your DSM-4 definition, but that is more of a practical definition. So the way that people tend to abuse or misuse drugs is taking too much, or which is typically like binge drinking. So like instead of a glass of wine, red wine is typically meant to be healthy. 12 glasses of wine, not so much. Okay? I have my uncle who's like 65, and he glommed onto this in the news. He goes, glass of wine is healthy for you, so 12 must make me 12 times healthier. No, didn't stop him, mind you. Or smaller doses more often, combination of. Too long, drug is no longer needed, and you tend to take it longer. This is typically prescription medication, and what drug do you think is the most commonly taken far too long?
Valium?
Valium? Yep. Nowadays?
Tylenol 3.
Close, that's codeine, yeah. Yeah, Percocets and Oxycontin, painkillers. People will take painkillers for pain, but then they think, oh wow, you know what? I'm not as stressed as much as I was, and the pain's gone, but I'm going to still continue using that. Then there's the wrong use, different illness or complaints, or using somebody else's prescription medications. I know some kids swear that they get high by taking antidepressants. They don't, but they swear they do. A lot of the kids that have ADHD will sell their Ritalin, and Ritalin is speed. That's basically all it is. It's a form of methamphetamine. It works if you have ADHD. They don't know how. The theory is that it helps you focus because it sharpens the brain if you have ADHD. If you don't, it actually gives you a high. So people will use other people's medications, go into their mom's pill box and take whatever. I mean, I've heard kids taking birth control pills thinking it's going to get them high. Okay, so then there's the most dangerous is the wrong combination. Okay. And combinations can produce unwanted and typically dangerous effects. The one thing that you're going to hear me say a lot about this, and if anybody says otherwise, they're wrong. Anybody says will or does when it comes to drug use and humans, wrong. May, might. Okay? Remember that from any kind of statistical course. There is no A-B cause and effect. Okay? And anybody that tells you that, wrong. Okay? Because you all know we're dealing with humans here, we're dealing with drugs, we're even dealing with basic physiology. People metabolize drugs differently. People's reactions to drugs are different. So it's not one size fits all when it comes to addiction. But, having said that, I'm going to break my rule for 30 seconds and just give you a little bit of hyperbolic expression that I like to tell anybody. Alcohol plus any drug equals death. Okay? Now, you're smart enough to know that that's not always the case, but it's a general rule. You never mix alcohol with any drug. It tends to cause the most damage. Okay? And the other thing is never mix like and like. So you never mix a depressant with a depressant. That's usually a recipe for suicide. Okay? Stimulant and stimulant, you can, but it's also might be a recipe for a stroke or a heart attack. Because what these drugs do is they potentiate, which means they add on top of each other. What typically does happen with a lot of addicts, or even non-addicts, is that they will use one drug to counteract the effects of another drug. So a common use of drug socially may be cocaine and alcohol. Alcohol's a depressant, cocaine's a stimulant. What it does is it kind of evens you out. But the neat thing about this is that those two drugs actually form a third drug in your system. It's called coca-acetylene. It's a different type of drug that actually causes a different type of high, and it puts you at higher risk factor.